Welcome to Unit 1, The Growing Crisis in Healthcare. When you're in spiritual, physical, or mental pain, where do you go for help? Do you go to a surgeon, your local doctor, a nurse, perhaps a friend, or an acupuncturist? Maybe you call 911. Do you go to the same places that your mother did, that your daughter does? Or how about your friend? And does it vary with need? Acute care in the United States is active short-term treatment for severe injury, urgent illness, or recovery from surgery. We actually do this quite well. It's something we can depend on to take us through many emergencies. Palliative care, however, is a condition of short duration that cannot be controlled nor cured. The shortness usually results in death. Chronic care is for a long-lasting condition that can be controlled but not cured, and this is what we're going to spend the rest of this short unit discussing. Chronic care is really big in the United States. In 2009, 140 million Americans, almost 1 out of every 2 adults, had at least one chronic illness as defined and diagnosed by a doctor. In 2006, 28% of Americans had 2 or more chronic conditions, and they are responsible for 2/3 of healthcare spending. More than 2/3 of Medicare expenditures are for beneficiaries with 5 or more chronic conditions. We seem to start and just add them in as time goes on. And this leads to great cost in lives. Chronic disease is the leading cause of death and disability in the United States, accounting for 70% of all deaths. But it is also a huge financial cost, which we hear in the news every day. Chronic disease makes up 85% of the more than $2 trillion that is spent in this country on healthcare. The problem and the tragedy of all of this is that chronic health conditions are preventable. According to the World Health Organization, 80% of heart disease, stroke, and type 2 diabetes could be preventable with things we already know how to do. In cancer, 40%, although I believe, according to recent studies, that number is rising. And that's because the risk factors of chronic disease are things we all know about: lack of physical activity, poor nutrition, tobacco use, and excessive alcohol consumption. It is easier and cheaper to prevent the onset of a disease than it is to treat it once the disease has developed, said the International Summit on Integrative Medicine. And that is one of the challenges we're going to take on in this course, is to take a look at our own bodies and our own state of illness and wellness and see how we can improve the prospects for our future health. In our country today, the current paradigm for treating chronic health conditions is not very good. We lack prevention. We lack any real sense of self-care. The medications that we take aren't curative and in fact may even be costly and cause unwanted side effects themselves. And the main problem in my mind is that we as individuals are treated reductively, one condition and one symptom at a time, which can often result in conflicting diagnosis between practitioners, interactions between our drugs, uncoordinated treatment among a variety of professionals, and service delivery. So many Americans have turned beyond the traditional Western medical system into complementary and alternative medicine, which has been called CAM. In the US, you can see that there's been tremendous growth in CAM, from 36 to 38% in 2007, and children too were seeing increasing numbers. CAM tries to address prevention. It is more patient-active and patient-led. It includes the concept of self-care, and it offers a range of modalities to do that. In clinics, integrative medical clinics or individual CAM clinics, the most clinical success has been in the areas of pain, gastrointestinal disorders, depression and anxiety, cancer, and the alleviation of stress. But CAM itself has limitations. Notably, you have multiple uncoordinated providers. You might go here for your massage, here for your acupuncturist, here to your therapist. And there's not often a common understanding among these professionals of what the treatment and disease model is. I know this for certain. I can go at 10 o'clock to one who at 11 o'clock will be completely contradicted by the next person I see. The patient therefore has to find that help and be able to reconcile very different treatment protocols when practitioners disagree. Also, for many of these modalities, there is still lack of evidence that the treatment will work for the exact condition that you have. And even within these, the self-care model is not always fully developed. So integrative medicine has been evolving in this country since the 80s. It's a healing-oriented medicine that takes into account the whole person, body, mind, and spirit, including all aspects of lifestyle, and it emphasizes the therapeutic relationship and makes use of all appropriate therapies, both conventional and alternative. But this raises us a lot of questions that we're going to address during this course. Who is this whole person? What exactly do we mean by body, mind, and spirit? And what is our current capacity to use all of them to self-heal? What is our potential capacity, and how can we work towards it? How do we engage with others in healing? And in fact, which of our relationships are therapeutic? And then how do our minds engage with our bodies and our spirits in order to make effective medical decisions? So the goal for our course is to increase our capacity for self-healing and self-care, to take those two central green circles and make them bigger, make them our first port of call, so that we become a flourishing person. And then to create an environment around us in our relationships and in our healing environment that we place ourselves that support this healing and growth within ourselves. And at that moment, if we still need help, that's when we go looking for the professionals to increase, and we also want to increase our decision-making abilities when we're choosing any medical or healing resource. And that's the end of this unit.
Whoa!